As an advocate for maternal child health justice, I'm continuously asking myself the same question. And today, I'm posing this question to you. What is the value of a Black body? During my time as a public health professional, I never knew the amount of devastation I would see in communities, families, and for women of color impacted by injustice. Welcoming a child into the world should be the most joyous and celebrated experience in one's life. But for many Black women, this time has turned into a cloud of fear and concern, wondering if you'll be the next statistic in a growing crisis. In the United States, Black women are 3 to 4 times more likely to die from pregnancy-related complications when compared to their white counterparts. And Black babies are twice as likely to die before their first birthday. Now, this data around disparities is not anything new or fresh on the scene. In fact, the US is one of the wealthiest countries in the world, but yet has some of the highest maternal death rates when compared to other developed countries of the same industrialized status. The preventable deaths of Black women continue to rise persistently over the last 6 decades. And when we think about Black women and their families, there has been numerous accounts of racism, discrimination, and mistreatment. As a consequence, these injustices have a reflection on the birth outcomes that we see today. Now, a moment ago, I mentioned that the deaths of Black women are preventable within this crisis. This year, the CDC released new data that states that over 80% of pregnancy-related deaths are preventable within the United States. So that begs 2 questions. Why are Black mothers and babies dying at disproportionate rates? And why is the US failing Black women? One leading cause is racism. Dr. Kamara Phyllis Jones, advocate, professor, and former executive director of the American Public Health Association, defines racism as a system that assigns value based on how one person looks. She also says that racism saps the strength of the whole society. And I pause and I refrain to say that racism saps the strength of the whole society. As we look over and take a glance back in history, over the 246 years of slavery and beyond, Black people and their partners have endured numerous sexual and reproductive acts of violence. Black women were known as breeders, abused, raped, and in many states were denied the right of marriage. Instead of being looked at as an individual, Black women were looked at as some type of item or an object for commercial value. Beginning in the 1800s, Dr. Francois Marie Provost performed over 30 experimental C-sections on Black enslaved women inhumanely. And in the 19th century, James Merriam Sims, known as the father of modern gynecology, performed numerous experimental surgeries on Black women without any type of pain medication or anesthesia, believing that Black people did not feel pain. This deplorable history translates into the way that care is received for some Black people today. And as we look at a timeline of the Tuskegee experiment and the lack of consent for Henrietta Lacks and just the injustices that have been taking place over history, we see that over time that people of color have been silenced, devalued, and disrespected in many health settings. And furthermore, the stigmas and the myths and the stereotypes around Black bodies continue to perpetuate in some health systems today as racism, and really known as systemic racism. So as we're thinking about today, about all these injustices, we have to take a moment to go back in time and also think about how it translates into today. In 2016, there was a study that was completed at the University of Virginia, where white medical trainees were asked questions in regards to racial bias. Questions like, do Black people have thicker skin than their white counterparts? Do Black people have nerve endings that are less sensitive than their white counterparts? And do Black people have blood that clots faster than their white counterparts? And for many of the white medical trainees in the study, the answer was yes to these 3 questions, further demonstrating that in the 21st century, that this stigmatized thinking has become a commonplace in some of our healthcare practices. Now, maternal mortality impacts women and families from all different backgrounds, socioeconomic statuses, sexual orientations, age groups. And as we think about stories revealed from celebrities like Beyonce and Serena Williams regarding complications and unheard voices during their pregnancy and postpartum experiences, that it mirrors and it draws symmetry to so many Black voices that have gone unheard today. And the impermissible deaths of Kira Johnson, Shalon Irving, Amber Rose Isaac, and Shamani Gibson, as well as many other Black women, tear at the fabric of our communities and the foundation of our families. So as we talk about actionable strategies to ignite meaningful change, it is time to stand up and protect Black women. Solutions found around equity or meeting people where they are needed and required for this change. And this collective impact, it will look like listening to mothers' voices. It will look like amplifying the voices and the stories of Black people, as well as collaboration and linking arms in our communities. So first, it is imperative for healthcare providers, professionals, and staff to listen to the voices of Black mothers. Solutions around this should look like in healthcare practices where there are unbiased treatment, where we have shared decision-making so that all Black birthing people know that they are a collaborator in their own health. And this will ensure that no voice goes unheard and that respectful care is being taken seriously. We also have to think about amplifying the voices of Black birthing people and parents, and how there is so much power weaved in within each story, because the voices of parents matter. In addition to sharing the stories of parents and storytelling and how essential that can be for change, support people, family members can also help to advance changes in Black maternal health with a wealth of books and podcasts and social media toolkits, as well as the resources that are already in our communities established today. And lastly, for community members and leaders as yourself, it is time to collaborate and link arms within our community. We're looking to link arms by evaluating policies and advocating for the rights that we need, such as great medical care and affordable care, funding for doulas and midwifery support, all these different types of great advancements that can help to protect Black moms and babies. So what is the value of a Black body? The answer is invaluable. Black women and birthing people deserve to have care that is with dignity and respect throughout their pregnancy and their birth. So we have to hold tight to a mantra of empowerment, that there's nothing about us without us, to mobilize change and to impact change for Black birthing people. And in the words of Reverend Dr. Martin Luther King, that injustice anywhere is a threat to justice everywhere. To see pivotal changes in Black maternal health, it is our responsibility to collaborate and to dismantle systems of racism so that Black women and children can get the care that they need and deserve. Thank you.